Good afternoon, everyone, and thank you for joining today's webinar. My name is Katie Habert, and I'm a Deputy Director in the Behavioral Health Program for Substance Abuse at the Council of State Governments Justice Center, and I will be your moderator for today's discussion. First, I'd like to thank the Bureau of Justice Assistance for participating on the webinar today. I'd like to briefly talk through a couple of house cleaning items before we go ahead and get started. At any time during this webinar, you can go ahead and ask a question by typing it into the Q&A panel, which is located on the bottom right-hand portion of your screen. We will keep a running list of the content-related questions that we receive, and then we will ask our speakers to respond to the questions during the last segment of the webinar, and we will do our best to get through as many questions as possible. If you encounter any technical or audio problems during this webinar, please call the WebEx Technical Support Line at 1-866-229-3239. You can also chat us, and we can provide that number for you, again, if you have any problems moving forward. Please understand there are some technical issues that we may not be able to resolve, and for this reason, we are recording this event and we'll post it on our website, which will give you the link to that in just a few moments. We should have the webinar posted online early next week, and once it has been posted, we will email all of you a link to the recording as well. The Council of State Governments Justice Center works in partnership with the Bureau of Justice Assistance to administer the National Reentry Resource Center, which on your screen right now you can see our homepage. This resource center is continually updating with all sorts of different materials relevant to the reentry field. And we also archive all of our webinars, such as this one, so that you can listen to them at a later date. You can sign up for newsletters and other announcements at the website, at the link that you see on your screen right now. Our presenters for today's webinar are Ms. Danica Bingley, who's a policy advisor at the Bureau of Justice Assistance, U.S. Department of Justice, and she will also be joined by Dr. Gary Dennis, who is a senior policy advisor at the Bureau of Justice Assistance, U.S. Department of Justice. And we are thrilled to have both Ms. Bingley and Dr. Dennis here today. I'd like to thank them both for taking time out of their schedules to do the webinar today. Before we go into their comments, I'll just say a few introductory words about the Second Chance Act as well as today's webinar. As you can see, in terms of what we'll cover today on the webinar, we're going to do a very brief overview of the Second Chance Act and then move into the meat of the webinar today, which will be a discussion on Section 201, adults with co-occurring substance abuse and mental health disorders, and the FY14 solicitation that was recently released. We will end the webinar with some time for some questions and answers as well. The Second Chance Act was signed into law on April 8, 2008, and is initially authorized for $165 million for prisoner reentry programs in fiscal years 2009 and 2010. And of course, the purpose of the Second Chance Act is to assist states and local communities with reducing recidivism for folks returning to communities from prisons and jails. In fiscal year 2014, $67.7 million was appropriated for Second Chance Act grant programs, and this funding will be distributed between adult and juvenile grant programs and across solicitations. There are 3 FY14 solicitations that have been released to date. The first one is the Smart Supervision Program, reducing prison populations, saving money, and creating safer communities, which you see the link on your screen. Please note that this Smart Supervision Program was formerly named the Smart Probation Program, but the name has changed because it is now open to parole as well. The other solicitation that has been released is the one that we are discussing today, the Reentry Program for Adult Offenders with Co-occurring Substance Abuse and Mental Health Disorders. And the third that has been released so far is the Technology Career Training Program for incarcerated adults and juveniles. And again, all of those links are on your screen right now. To receive announcements when new SCA solicitations are posted, you can sign up for the National Reentry Resource Center newsletter at the link on your screen, which is csgjusticecenter.org/subscribe. So with that, I'd actually like to turn over the webinar to Ms. Bingley to begin her comments for the day.
Great. Thanks so much, Katie. As Katie said, my name is Danica Bingley. I am a policy advisor here at BJA, and I'm actually new to this particular grant program, although not new to BJA. I actually oversee all of our mental health programming, including the Justice and Mental Health Collaboration Program, and have recently acquired the Second Chance Act program targeting treatment to incarcerated and re-entering adults with co-occurring substance abuse and mental health disorders. Although I am luckily working still with Gary Dennis on this program, who many of you know. And he'll be available at the end of our webinar today, along with me to answer any of your questions that come up during the webinar. Now that said, I'm going to be going through these slides which really talk about the requirements of the program that are all included in the solicitation. So if you have the solicitation, there's nothing in the slides that we'll be going over that's not in the solicitation. So as Katie stated, you'll be receiving these slides next week, but also all of the requirements and details that are spelled out in this webinar today, again, are in the solicitation. So I would refer you to that if you have any questions. And so moving to our next slide, number 7, I actually want to refer you to the link that is here for the solicitation. If you've not visited it yet already, there is a link at the bottom of the slide. But I do want to direct your attention also to the fact that the end date, the closing date, is March 18th, and all applications are due by 11:59 p.m. Eastern Time. There is assistance available through the BJA Justice Information Center, but only through 8 p.m. Eastern Time. We state this through all of our grant programs, and I can't emphasize it enough how important it is to not wait until the last minute in submitting your application. If you can get it in early, well before the deadline, please do. Inevitably, there are always some technical difficulties or complications that come up when submitting applications. It's just the nature of the beast. So really try and give yourself some wiggle room, a couple days lead time at the very least to submit your application, so we're not dealing with last-minute crises if we can at all avoid them. Next slide. So getting into the meat of this solicitation, I'm just going to speak briefly about the information that's presented here. I do want to give lots of time for questions so that we can avail ourselves to you. So I won't be reading word for word what's on the slides. Again, you'll have those as of next week. So I'll just be going briefly through the content and trying to leave as much time for questions as possible. But I do want to direct your attention to this slide in that it does point out that the Second Chance Act is really authorized, or it authorizes us to make awards to states, units of local governments, and tribes to improve the provision of substance abuse and mental health disorder treatment to individuals in prisons and jails during the period of incarceration, through the completion of parole or other court supervision after release into the community. And specifically, we're seeking applications from eligible applicants to implement or expand offender treatment programs for reentering offenders with co-occurring substance abuse and mental health disorders. So why that's so important? Because the eligibility, as you'll see in the next section, is really limited to states, units of local government, and federally recognized Indian tribes as determined by the Secretary of the Interior. Unfortunately, this grant program is limited to that restricted pool of applicants at this time. If the legislation changes in the future, that might change, but as for now, we are restricted by the legislation to that eligibility criteria. Entities that don't meet this eligibility requirement are not eligible to apply, unfortunately. But what you may do, if you are an ineligible entity at this time, you can partner with eligible applicants. So say you're a treatment provider that's a nonprofit or non-governmental, and you really want to apply for this, well, you can partner with your local jurisdiction, either local government or state or tribe, to submit the application on your behalf, demonstrating your partnership. Next slide. So next I want to go through the approved uses of funds. In general, the treatment of co-occurring substance abuse and mental health disorders in prisons and jails is the primary focus of this funding. And as you'll see below, co-occurring disorders really refer to co-occurring substance-related and mental health disorders. Clients said to have co-occurring disorders have one or more substance-related disorder as well as one or more mental health disorder. At the individual level, co-occurring disorders exist when at least one disorder of each type can be established independent of the other and is not simply a cluster of symptoms resulting from a single disorder. Providing recovery support services, reentry planning and programming, and post-release treatment and aftercare programming in the community through the completion of parole or court supervision, again, is really the focus of this funding. Next slide. So in looking at the different phases of the awards, there is both a planning phase and an implementation phase of each award. And for those of you that aren't familiar with the way that this type of award works, essentially, during the planning phase, you would receive an intensive technical assistance provided by the National Reentry Resource Center, who will work with you to complete and receive approval for a planning and implementation guide for your project or program. Once those planning and implementation guides are submitted and approved by BJA, then you successfully move on from the planning phase to the implementation phase of your project so that you can obtain access to the rest of your funds. So in talking about what the planning phase looks like, next slide. Approved uses include activities that look at, obviously, the planning of your project. So continuing to establish a program design, including the integration of an integrated care model. Also, continuing or starting a strategic plan for the implementation of the Affordable Care Act into your program design. Development on a continuum of care model. As well as looking at how you can improve and enhance the use of screening and assessment to ensure that the proper individuals are selected for the proper programs and the proper programming. As well as engage in strategic planning to ensure that your program exists in the long term and is successful. Next slide. So next, moving on to the implementation phase. In the implementation phase, there are design elements that must be included in your application, and those are all listed here under these bullet points. I won't go through each one individually because they're listed out. It's also in the solicitation, and it's very self-explanatory. It's very clear in terms of what is required. But I do encourage you to make sure as you go through your application, you are including each one of these program design elements in your application as part of the implementation of your program. Next slide. So this continues on each of the program design elements. Again, I'm not going to go into detail. They're listed out here very clearly for you. Next slide. So next I want to point out some of our priority considerations. And I want to spend a little bit of time here because I've already had a number of questions from the field about some of our priority considerations and what that means in terms of priority consideration given for these. So we've listed out these bullets here, which again is in the solicitation as well, as priority considerations. And I just want to walk through these very briefly. So the first is incorporate a pay-for-success model into your project. I've had a lot of questions about whether this is required or not, and obviously it's listed as a priority consideration, not a program requirement or a design element, so it's not a requirement. And I will state that we have not yet had an applicant come in successfully with a proposed pay-for-success model as part of the project under the Second Chance Act programming. We have under some of our other programs here at BJA, but not specifically in this context. So it's difficult for me to speak to what that looks like specifically under the Second Chance Act umbrella, but I also offer that to you as an example of the fact that we have not funded a Second Chance Act Pay for Success program yet. So the door is wide open here, and the possibilities are endless. But that, again, it's not a requirement. We just want to encourage folks to be thinking about Pay for Success and think about wanting to incorporate this model into your project, and we want to encourage that. So we will give priority consideration, and what that means is that this, along with all the other bullets that are listed here, will be taken into consideration when we're making our funding decisions. So next, focusing on post-release community-based programs, providing quality evidence-based treatment services for returning individuals with co-occurring disorders upon release. So the keywords here are evidence-based treatment services in that post-release community-based program setting. Next, identify and target medium to high-risk offenders with serious mental health disorders and substance abuse addictions through validated risk and needs assessment instruments. So here the keywords are medium to high-risk offenders and validated risk and needs assessment instruments. So that's really what we're targeting here under this priority consideration. Next is focusing on geographic areas with high rates of returning offenders. Next, jurisdictions implementing specialized probation services as described in the consensus projects, improving responses to people with mental illnesses, the essential elements of specialized probation initiatives. So obviously I would refer you to that particular publication for more information about those types of specialized probation services. Next, jurisdictions proposing to partner with research organizations to conduct rigorous local evaluation of their strategies. Obviously, evaluation being the key word in this priority consideration. The next consideration is to incorporate innovative uses of technology which leverage electronic information sharing and communication to advance the specific goals of this solicitation. Next, I want to draw your attention to a very important bullet, the Affordable Care Act. So looking at developing and implementing strategies to identify and enroll eligible program participants into Medicaid or other insurance through health exchanges and to connect them to treatment providers as appropriate. So as many of you hopefully know, under the Affordable Care Act this year, many individuals who may not have been eligible for Medicaid before now are eligible. And we here at BJA are really making a concerted effort to connect those individuals, especially those returning from jails and prison, to Medicaid so that they can be connected to health services, which include substance abuse and mental health treatment as a required benefit under the Affordable Care Act. So it's so important that we connect these individuals to Medicaid and other health insurance as appropriate so that they can receive these services and hopefully keep them from returning to our jails and prisons. The next priority consideration is targeting high-risk offenders that are experiencing or at risk of chronic homelessness. And last, link grant-funded activities and services to affordable and supportive housing. So the last two, obviously, very important in the homelessness context around housing and homelessness. Next slide. The mandatory treatment requirements. So this is incredibly important as a mandatory requirement for this program. Applicants must certify that the treatment program proposed is clinically appropriate, will provide comprehensive treatment, and has been developed in consultation with a single state authority for substance abuse services. Applicants should provide official documentation that all collaborating service provider organizations are in compliance with all requirements for licensing, accreditation, and certification, including state and local, or city and county, and tribal requirements as appropriate. Applications submitted by federally recognized tribes must submit a tribal authorizing resolution. Next slide. So those are the requirements of the program. Now I want to go through with you a little bit about what your application needs to include and how exactly to structure your application. So this is just a breakdown of the selection criteria by section in terms of how BJA will weight each individual section. Next slide. The statement of the problem. Again, this information is really in your solicitation, but I just want to point out a few points here. So one thing that's really important to include in your statement of the problem is any data that you have that you can refer to, including obviously the target population, the numbers of offenders with co-occurring substance abuse and mental health disorders with correctional detention facilities who are returning to the community, and any recidivism and substance abuse data available for the target population. So the key word, the operative word here being data. Whatever you can share about your jurisdiction is important in this section. We also would like to know what you're currently doing. So your current processes for identifying risk needs and the availability of treatment services and what reentry planning goes on for these offenders, including linkages to community-based treatment providers and case management. And then last, I just want to draw your attention here to this last bullet. This is really important for your statement of problem. Obviously, all of these components are important, but a lot of people miss this last one here, and that's providing a baseline recidivism rate for the proposed target population and discussing the level of reduction in recidivism you would consider to be a success. So this can't be a pie-in-the-sky number that you pull out of thin air that would sound great, but is not really based on your jurisdiction. So if you don't have a baseline recidivism rate for a historical sample of ex-offenders similar to the target population, you've got to provide a rate for another population. But really, we really want to get at your target population here and providing that baseline recidivism rate. Next slide. In the program design and implementation, again, I won't go over all of these elements. These are the ones that are that were referenced earlier and are in the solicitation. But this really, the program design and implementation section is really the heart of your application. So we really want you to focus on how your proposed activities are really going to address your program goals. Describing how the planning phase activities will be addressed, including the planning and implementation guide, as well as all of those program design elements, those that we referenced earlier. Next slide. And this is also the section where you address any applicable priority considerations. So all of those priority considerations that I just went through, those are also included here in your program design and implementation section. And obviously you want to get credit for those. So make sure that you do spell those out, how you are addressing these, if at all. Next slide. So also in your program design and implementation section, you're going to be providing operational guidelines for how you're going to be identifying eligible program participants, which should include a plan to screen potential participants, conduct risk and needs assessments, and the process for referring individuals to the program. So that process is really important to include. You also want to describe how many people the proposed program plans to serve over the length of the project period. Again, this is something that a lot of individuals leave out of their applications, and it's really important that we have an accurate idea at how many individuals your program can serve and plans to serve. We're going to be tracking this number provided throughout the duration of your award. So again, it's important to be accurate, or as accurate as you can be, not just picking a pie-in-the-sky number that sounds good, but something that's reasonable and that is based on the data that you have at hand. Also, providing a description of both the pre-release screening and assessment process and the post-release services for every program participant is important to include, as well as describing the process for linking individuals to treatment and other recovery support services. And last, really describing the mechanisms that will be put in place to ensure the accountability of the services delivery system on an ongoing basis. Again, all of this is listed in your solicitation. I'm only going over the points here that I really want to emphasize for you. Next slide. So looking at your capabilities, competencies, and coordination. Again, this is in the solicitation, but I just want to point out here that you really want to demonstrate not only your capability within your own organization as the applicant, but also with your partners. So the collaborative partners that you'll be working with is important to demonstrate their capabilities and competencies as well as to really identify those organizations and partners within the community who will be providing the services to the individual. And really making sure that you're providing enough information to show that you can successfully carry out this award. And last, I just want to bring your attention to this last bullet here, indicating whether the applicant jurisdiction is a current recipient of funds from other BJA administered programs. This is important for us to know, and we ask you to let us know if you have received funds under any of these grant programs. And if so, we really want you to also address how these initiatives will be coordinated if the applicant becomes a recipient of funds from this program or any other applying for. Next slide. So next is the impact, outcomes, evaluation, and sustainment, and plan for collecting the data required for the solicitation's performance measures. So performance measures is something very important to BJA and should be something very important to you too. Collecting data is vital to the success of your program as well as to, obviously, your receiving grant funds in the future. So it's important to really describe the current ability to collect and analyze performance and outcome data, which also includes the ability to share data with agencies such as the department, or any service agencies, essentially, that you might need to share data with. Outlining how and what data information will be collected and analyzed, and determining the effectiveness of the treatment program implemented or enhanced, and describing how randomized trials will be used wherever practicable. Also describing how performance will be documented, monitored, evaluated, and identifying the impact of the strategy once it's implemented. And last, describing how performance will be documented, monitored, and evaluated, and, that's the same. It was so important we put it twice. We really want you to describe how performance will be documented, monitored, and evaluated, and identify the impact of the strategy once implemented. So obviously we can't emphasize that enough. Next slide. So continuing on, I just want to point out this first bullet also as being something that I think a lot of applicants feel uneasy about pointing out existing barriers to collecting data or collaboration. We want you to feel comfortable in explaining this in your application if there are any existing barriers. And we really want to hear how this grant may improve collaboration or access to treatment services beyond this particular program. Also, we want to hear about how other variables like stakeholder support and service coordination will be defined and measured, as well as evaluation and collaborative partnerships, how they will be leveraged to build long-term support and resources to sustain the project when the federal grant ends. This is very important. In a time where the federal budget has been shrinking each year for the last several years, and the future is really uncertain. We really want to make sure that your programs survive and aren't dependent on federal funding alone. So this is really important to include in your application. Next slide. Now I want to take your attention to the budget section. So this also obviously is a very important section. 10% weighted of your entire application. There is no match requirement, which is good news under the Second Chance Act. But I will say that if you do put in an agency match within your application, even though it's not required, a lot of people do this, just know that you are then held to that match that you've put in your budget. that then becomes a mandatory requirement of your award if it is proposed and approved. Unallowable uses of award funds, I just want to direct your attention here to the OJP Financial Guide. That's the best resource to point you to for all questions around unallowable uses of award funds. So this has gotten tighter, I would say, over the last several years in terms of how funds can be used. And we just want to point out that they may not be used for prizes, rewards, entertainment, trinkets, or any type of monetary incentive, client stipends, gift cards, vehicles, food, and beverage. So this comes up a lot, especially in the drug court context, where a lot of those programs have been using incentives or rewards as part of their program model for a long time. And unfortunately, incentives that are listed here cannot be funded through grant funds. That's not to say you can't use another source of funding for those types of incentives, but unfortunately you can't use federal funds for that purpose. So I just want to be clear on that, including all food and beverage. And then the other budget requirements, again, this is also listed out in the solicitation. I will just point out to you the conference meeting training budget requirement. We really encourage applicants to propose to use award funds for any conference meeting or training related activity to review carefully before submitting an application this policy, the OJP policy around conference approval. That also has changed in the past few years, which many of you may know. It's become a lot more regulated around the types of conference events and gaining approval for them. Next slide. So if you need technical assistance with submitting your application, I would point you to the grants.gov customer support hotline. These numbers are really important, 800-518-4726. Or you can also email the grants.gov hotline at support@grants.gov. And those are just for technical issues with submitting your application. As for the solicitation requirements, if you have questions about these, obviously we'll have time in just a minute to answer your questions. But if your question does not get answered today, you can also reach out to our BJA Justice Information Center at the number here, 1-877-927-5657, or you can email the Justice Information Center at capital JIC at TELESISHQ.com. Just to point out that the Justice Information Center hours of operation are 8:30 to 5 Eastern Time, Monday through Friday, and 8:30 to 8 p.m. on the date the solicitation closes. With that, we're now going to open it up to your questions. And again, I would just emphasize that I went through just some of the key points that I wanted to point out to you today, but that all of the requirements are listed in the solicitation, and I encourage you to please read it fully and completely before submitting your application. So with that, I think we're going to turn it over back to Katie to moderate our questions and answers.
Great. Thank you so much, Danica. I really appreciate you walking us through all of that. As Danica mentioned, we have some time for questions, and I'd definitely encourage you all to take advantage of this time. As a reminder, you can ask a question by typing it into the Q&A panel, which is on the bottom right-hand portion of your screen. And we already have a bunch of questions coming in, and so we'll just go ahead and jump right in and get started. One of the questions we received is, if you are a treatment center and you partner with one of the eligible entities, does the eligible entity have to be the lead financial agency as well for this grant?
Yes.
Great. We have a question about what is pay for success from someone who's unfamiliar with the term in the practice and was wondering if either you wouldn't mind going through that a little bit, or we can also include some documents when we send out the recording of the webinar as well.
Yeah, I'll actually ask Gary to speak about that a little bit, but I will say that in the solicitation, it does provide more explanation about what Pay for Success is, and there are some resources that we can point you to, including the Pay for Success website, which provides a little more information. But Gary, if you wouldn't mind providing a little bit more context about Pay for Success.
Sure. I'm not real sure that I can provide a whole lot of additional information over what Danica said. There are a couple of links in the solicitation. The Department of Labor has been successful in funding several Pay for Success projects. The essence of this is it really turns out to be a collaborative relationship between generally a philanthropic organization or another group that is willing to put up money. The idea behind it is that they invest in the project, and hopefully, if things go well, they not only recoup their investment, but they also get some return on the investment. But it's the idea of leveraging private money to help to ensure success and then compensate them for that. It's a pretty complicated process, and it's going to be, as Danica pointed out, we funded one project in Cuyahoga County, just a reentry demonstration project that has worked a little bit with a Pay for Success model, but they're running into significant issues. So I would just encourage you to read the information that's in the solicitation, visit the links that are there. We'll give you a little bit more information about the concept. But as Danica said, this is only a priority consideration, and you should not feel obligated to try to work out a Pay for Success model for your particular project. If you can, that's great, but we understand that it's difficult to do. And I guess I'm a little bit apologetic that I can't be more specific, but the information, the links that are in the solicitation will provide you some good information there.
Great, thank you. Our next question is in regards to providing residential treatment facilities set apart. We have a question about, for prison-based programs, it states that applicants must provide residential treatment facilities set apart from the general correctional population, and this person is wondering if this also applies to jail-based programs.
I think the answer, I'll go step in here, Danica. I think the answer is yes. What we're looking for is some semblance of a therapeutic community model. And I realize that it is much more difficult to do that in a jail setting, but I think that's where we want to call upon applicants' creativity to figure out a way to at least make an attempt to keep the folks that are involved in the treatment program in the jail somewhat separate from the general population. But again, it goes back to the therapeutic community model. Two things. One, that people who are in a program together tend to be supportive of each other. And of course, the other is that if you can keep them isolated or a little bit separate from the general population, it may reduce the tendency to perhaps backslide in the program. But we just ask you to do the best you can. It goes for both a prison-based as well as jail-based programming. But we understand that sometimes because of the fiscal problems that you have in a jail, that it's more difficult.
Great, thank you. We have a question about the planning and implementation phases, and wondering if you all have any thoughts about how much time potential grantees should expect to be spending in each phase. So that's the part one of the question, just wondering how long they would plan on spending in planning versus implementation, if there are any expectations around that. And wondering about any chance of the timeline sort of being extended to do both the planning and implementation piece.
Well, Katie, can you speak a little bit to that in terms of what you've seen as the technical assistance provider in terms of average times folks have spent in planning versus implementation?
Sure. So, and just to clarify, with the co-occurring grantees previously, there hasn't been a set planning stage and then implementation stage.
Oh, okay, okay.
But I would
right.
say
okay.
that.
But JMACP, the Justice
Yes,
Mental Health Collaboration Program, has done that for a long time, correct?
Yes, we have. So I would actually say, so I apologize. Obviously, I'm new to this program, but I've been managing justice and mental health for the past several years. So this is how we've been structuring the program for as long as I've worked with it. In general, I would say that it varies in terms of grantees in the planning phase. It can be anywhere from a couple of months to maybe 6 months, but certainly it's not going to hurt the remainder, the implementation of your project. We do have the option available for a no-cost extension. For those of you who are past grantees, you may have utilized this option before, where we can extend your grant out at no cost to you. That's no problem. We certainly understand when there are challenges or holdups that keep you from implementing your program in the estimated time frame that you put in your application. And I will say that, the planning phase, you really do receive intensive technical assistance from the Reentry Resource Center, who will work with you in putting your guide together and getting it approved. So that by the time it reaches BJA, it's really at that final stage and everyone's signed off on it. It's not like you're left on your own to put something together and then submit it to the Reentry Resource Center, who takes one look and says, no, back to the drawing board. It's not like that at all. They're with you every step of the way and really, really help you get it done in the shortest amount of time possible, so we can all get on the same page and you can begin your program activities. So I hope that answers the question.
Great, thank you. We have a question about if there is an anticipated number of awards that might be made under this category.
At this point, we haven't received our final numbers. We do have an appropriation, but there's a certain amount of money that comes off of that appropriation for all kinds of expenses, including M&A and other programmatic costs. So I haven't seen any numbers as to what we can expect our final grant amount to be. So at this point, unfortunately, we haven't come up with any estimates yet.
Thank you. We have a question. Does an application with proposed matching funds have an improved chance of being funded?
I would say no. It only if it somehow improves your overall budget or overall capacity to deliver services. I mean, sometimes having an agency match is helpful to demonstrate commitment by the agency that there will be sustainability for the program and the long-term health of the program has a better chance of surviving, and that can be helpful to demonstrate that. I wouldn't say that there's per se an advantage to having match, but like I said, we really do put emphasis on trying to make sure that programs have the ability to be sustainable and survive past federal funding. So that can be evidence of other support to help toward that long-term sustainability.
Okay, thank you. So we have a question about if you all provide any guidance around defining evidence-based treatment services.
Yes, I'm not remembering if it's in this solicitation. I think that it is, but where we link to SAMHSA's identification of evidence-based treatment as defined by SAMHSA. So that's really who we rely on in terms of looking at evidence-based treatment services. So I believe there's a link in the solicitation, but if not, we'll make sure to include that in the resources that the Reentry Resource Center sends around with the slides next week to make sure that you have that.
Great, thank you. We have a question about, it looks like there needs a little bit of clarification. They have a question regarding dosage and intensity of services. And then the solicitation advises that high-risk offenders are given a minimum of 300 hours of cognitive-based interventions. And the question is, have you all seen that this may or may not limit the participants to those who may be incarcerated for a certain amount of time, or how that might work?
Gary, I don't know if you have any input on that. I don't know that we've seen that it limits. I mean, this is something that we're working on across our grant programs. It's really a best practice, an evidence-based practice that high-risk offenders be given appropriate treatment. It's part of the risk needs responsivity model that a high risk would have the appropriate responsivity and the same level of treatment. Risk doesn't necessarily pertain to offense or sentence, so I don't think, there's a lot of misconception about high-risk offenders in terms of risk meaning level or violence or that sort of risk, but really risk goes to risk of reoffense. It's looking at the criminogenic risk needs spectrum and those that score high on risk for reoffense. So not necessarily those that may be more or less violent than others. It really goes to that risk. So it doesn't necessarily pertain to the sentence or how long an individual is in prison for. I don't know if that answers your question. I'm not sure that I answered that sufficiently, but I don't know that it's really limited our grantees. It's just a best practice that those who do score in the high risk range receive treatment that is responsive to their risk level.
Yeah, let me just add too that some of those numbers are, as Danica said, they're really guidelines, but they're based on a lot of the work that Dr. Ed Latissa at the University of Cincinnati has done about treatment of moderate, high-risk, and low-risk offenders. And like Danica said, we're not talking about violence. We're talking about the risk of reoffending or recidivating. And what we found was that low-risk offenders, folks who are very compliant, sometimes we do more harm to them than we do good, but yet they're the folks that we most often like to work with. So we're looking for a challenge. We're also trying to push people in the direction of using validated risk needs assessment so they get some idea of how much of a dose of treatment folks need. But keep in mind, too, that these programs, the scoring applications, in my opinion, are going to be the ones that represent a continuum of services, that either through participation in an RSAT-funded program behind the walls, or through a program that's funded using this particular grant money, and then the transition into the community. So if you talk about 300 hours of cognitive treatment, that could take place partially behind the walls and then follow through in the community. In fact, what we found is that there's very little efficacy in what we do behind the walls in a therapeutic community or whatever, unless we have just as strong program elements in the community once they re-enter. So think about the 300 hours, think about the dose, not just being, but being on a continuum over a period of time, and maybe it doesn't seem quite so daunting.
Great, thank you. And I think that we have time for maybe one or two more questions. We have a question here from a coordinator who is a coordinator of both a mental health court and a veterans treatment court, both of which have co-occurring participants. And the question is, would they be allowed to apply for the grant to affect both of those programs, or would the solicitation be limited to one court program per grant?
I don't see why not. We don't place that restriction that it's limited to one court program, especially if they're being administered jointly by the same individual. Obviously, it would have to be something I mean, you'd have to design a model that would work, but no, that could be plausible.
Great, thank you. So I think we have time. This will be the last question that we have. So let me see here. Can you talk a little bit more? There seems to be an emphasis on sustainability in the solicitation and in the presentation today. And the question is, we're wondering if you're able to describe how sustainability will be evaluated, if it's part of that planning and implementation guide or part of some other evaluation measures.
No, that's just part of your application. So as part of the requirements in your proposal that you submit to us, you will provide your plan for sustainability, and that will be evaluated in the peer review process as well as the BJA internal review process. It's just one factor that we look at amongst others, but an important factor.
Great, thank you. I apologize, there were a few questions that we're unable to get to, but I think that there are a few that hopefully when you listen to the recording, they will be answered and I can respond as well. First, want to thank both Danica and Dr. Dennis for doing this webinar today. As you all can see on your screen, there's a link there to the National Reentry Resource Center, and you can go ahead and subscribe to updates there so you're aware of these solicitations as well as future ones as they're released. And again, you can use that link that's on your screen. This next slide shows a link to the Bureau of Justice Assistance webpage, so please as well use that as a resource. There's many links to other resources, additional solicitations, etc. So please feel free to visit the Bureau of Justice Assistance website as well. This concludes today's webinar. After you exit the webinar, a brief survey will appear on the screen, and we'd greatly appreciate it if you would take just a few minutes to complete the survey. As we mentioned previously, we will email a link to the recording of this presentation as well as a link to a PDF of the PowerPoint slides used in the presentation early next week. And again, these will also be made available on the National Reentry Resource Center website as well. Thank you again to Ms. Bingley and Dr. Dennis and the Bureau of Justice Assistance for your partnership. And thank you to all of you who participated on today's webinar. We hope you have a good rest of the day and take care.